does not always lead to better health. And that's important because it's not just about weight. It's about body fat. So weight and body mass index do not evaluate body compartments, meaning muscle, fat, water, and therefore do not reveal if weight changes result in loss of fat-free mass or gain in fat mass. In other words, it's body fat we want to lose. We don't want to lose muscle. How does muscle affect us with fat loss? Anybody know? Anybody give me a quick answer? Sorry?
Burns more calories.
Absolutely. So the more muscle you have on the body, the higher your metabolic rate and the more effective you are at being able to burn calories. So we want that muscle mass, which comes from exercise, eating the right amount of protein, etc., etc. I love this chart. Here's a gal right in the middle who wanted to lose weight. And she really didn't quite know how to do that. And she decided she was just going to cut back on the number of meals that she ate in a day. So she ate about 1 or 2 meals a day and felt that just by eating what she thought would be less would help her. In this situation, here, as you can see, I'm going to try my pointers. I'm going to use it on fire. The yellow is body fat and the red is muscle. Everybody see that from there? What ended up happening with only eating 1 or 2 meals a day, or what I call the sumo wrestler's diet, is this lady actually gained body fat and lost the lean muscle tissue, which is the red right here. So by losing lean muscle, so on a scale, let me go back. On a scale, it'll show weight loss, but that weight loss, because muscle weighs more than fat, is going to be some muscle, maybe some water weight. And is that lady going to gain that weight back pretty rapidly? Yeah, absolutely. And you compare that to the lady over here who's smiling. See, she's not smiling. This lady practices eating every 3 to 4 hours, which is really one of the main things that I'll work with everybody on, is eating every 3 to 4 hours to keep your blood sugar nice and stable. Exercising, not just every now and then, but having a consistent, regular plan of physical activity. Drinking enough water. Managing stress. Getting enough sleep. All the lifestyle things that Dr. Shavarasi spoke of. And what you will see here is an increased lean muscle tissue, the red, a decreased amount of body fat surrounding it, and a chance of being able to keep this body fat off. Here, you carry those 2 ladies down to here. This is vessels on either side. So if you look here on the right side, see how the yellow kind of gunky stuff? This is a lady who is eating a fairly high glycemic diet. Glycemic just means sugar. So too much of those processed carbohydrates, the white flour, most of the white stuff other than your cauliflower or jicama or white fish. So it's just your potatoes and your too much pasta and white bread. Those types of foods will produce high glucose, high cholesterol, excess insulin, and sugars, of course. And if you look at all these so-called pretty dots that's being spilled out here, that's a lot of sugar being dumped into the bloodstream. Does everybody see that? Compared to this side. Look at how much less it is over here. So the function of the body, this is how this kind of happens. See all the big things on the bottom here with all the points coming out? These are the cells that are in your body. Your cells need some sugar. It gives them their energy. That's what gives us our oomph to get up and go. It's the fuel. If too much is being put out at one time due to diet, the cells close off. They say, sorry, I'm being bombarded. I can't take you in anymore. Okay? That's kind of an insulin-resistant situation. And that sugar remains in the bloodstream, and the pancreas keeps shooting out insulin because its job is to drive that sugars into the cell. So you've got elevated insulin in the blood if that consistently happens. You've got the cells not being fed properly because they're closed off from more sugars being able to come in. And you've got a scenario that's just not working here. Over on this side here, it's a little bit cleaner. You see the blood vessels here? So there's healthy glucose levels, healthy insulin levels, healthy hormone balance, healthy blood pressure. We're having some carbohydrates, a normal amount being spilled into the bloodstream. The cells are taking them in for fuel and energy, saying thank you very much, that's what I needed to carry through my day. And everything is functioning optimally in this scenario here. Aging and muscle loss. It is typical, unfortunately, that as we age, we do tend to lose muscle. It is a physiological response as well as a response from us just not being as active as we used to be. No decline with age is as dramatic or potentially more significant than the decline in lean body mass. The Journal of Nutrition. Sarcopenia is a loss of muscle that occurs as people age. Is actually a term for that. It's the backdrop against which the drama of disease is played out. A body already depleted of protein because of aging is less able to withstand the protein catabolism that comes with acute illness or inadequate protein intake. So you take that person that's not exercising, not eating enough protein, doesn't have a good high-quality diet, and then becomes ill for whatever reason, it's a setup for that much more of an illness for that person, and it's difficult to turn around. Not impossible, but it makes it that much more difficult if there's not lean muscle mass that's attached to the body. It's really a biomarker of longevity and health to have that muscle. And that's printed in JAMA. Muscle is the major source of protein for functions such as antibody production, wound healing, and white blood cell production during illness. If the body's protein reserves are already depleted by sarcopenia, there is less to mobilize for illness. So, how do you maintain muscle as you age? Adequate nutritional support, the right nutritional supplements, the right diet, aggressive physical therapy and exercise. All this becomes that much more important for a higher quality of life to be preserved in older population. Now, Dr. Shawarasi mentioned the BIA, the Bioimpedance Analysis, which is a little kit that I have here with me. And this is what the ticker tape, so to speak, comes out looking like after we do your results. And it's broken down on the left side into compartments. So we've got your cells, which we have anywhere from 75 to 100 trillion cells in our body. It makes up your blood, your tissue, your organs, your skin. It's what we're all about, are our cells. And the cells have a membrane that surrounds them. And inside that membrane is intracellular water. And there is a lot that's associated with all this. We look at this BIA with the body cell mass, the fat-free mass. The fat-free mass consists of body cell mass and extracellular mass. There's a water level that we look at that's optimal for women and for men to have in their body. And so when I do the BIA, I'm reviewing with people what we call their phase angle, or the integrity of the membrane that surrounds all of their cells. We're looking at the body cell mass, which has to do with the fluid inside the cell and muscle. I'm looking at fat mass. You see where it says fat mass, where my red dot is here? It breaks it down into pounds and percentage. So I can tell what percentage is ideal for people. I can see where they're at. And I mostly, when they come back for repetitive visits, is the body fat going down? Is the body cell mass going up? Are we increasing muscle and fluid inside the cell, which is a good thing? Here is that BMI that just is a height to weight comparison. And here is the basal metabolic rate, the resting rate that Doctor talked about. So we know that this person is burning about 1925 without physical activity. So if they're doing physical activity on a regular basis, I will multiply this by either 1.1, 1.3, or 1.5, depending how physically active they are. So I can come up with a new baseline of calories for them. And then I will subtract like 300 to 500 calories from that to figure out what amount of calories they should be at if they want to lose body fat. If somebody wants to maintain, then I know what amount of calories they need to maintain.